This is Alice Lee Hagan, host of Business Education Spotlight, a new webcast of ThinkTech webcast series. Today we have our first guest here, Coral Andrews, and we're going to talk about the Healthcare Management Executive MBA program. Let me introduce Coral first. Coral she serves as the Regent for the Hawaii Pacific region of the American College of Healthcare Executives. It's also known as ACHE. It's a professional association with national affiliation. The headquarters is in Chicago, Illinois. The Hawaii Pacific region is inclusive of Hawaii and Guam. Coral has a diverse career background. She's a registered nurse and has focused the last 10 years on health policy, strategy, and innovation. She's board certified in healthcare management through ACHE. She serves as a liaison between the Hawaii Pacific chapter of ACHE and the board in Chicago. She's also a mentor and advisor to healthcare executives and peers, both locally and nationally. Welcome, Coral.
Oh, thank you, Alice.
Well, we have been working very hard in launching this Healthcare Executive MBA program at the University of Hawaii Shidler College of Business. Now, this is a 22-month program. It's a hybrid format, and we're going to launch it in August 2014. I know that a few days ago when we were talking about this interview, you commented that maybe this would be a good opportunity to reflect on how far we've come along. So maybe you can tell us a little bit about ACHE and how you decide, or how you and ACHE executives decided to approach the Shidler College of Business.
Sure, thank you. Well, the American College of Healthcare Executives serves as a professional association, has a long history, both nationally but here in Hawaii as well. Started out as a Lua Ali'i, many will remember, but it's a professional association whose one of its strategic objectives is to promote lifelong learning. And given the dynamic nature of healthcare in particular right now, it's even more critical that healthcare executives have a good solid business base. And so nationally they have 220 partnerships through something called the Higher Education Network. So across the United States there are these collaboratives between a university and the local chapter. And our board got together and just decided that it might be something we would want to approach the Shidler College of Business about. And so we began those conversations, and in a very short period of time, and thank you to the leadership of Dean Rowley and certainly your executive leadership, we've gotten a program going together, and we are there to serve as an industry advisor to the school as you're building this program.
Well, we're really excited about this program too, and for the past 2 months I've been going out talking to industry leaders, talking to prospective candidates, so there's certainly interest in it, and I think a lot of the comments that I hear, well, it's a really timely program, especially with the Affordable Care Act. So could you tell us a little bit about the implications of the Affordable Care Act and how this would affect the education and professional development of some of our healthcare professionals here in Hawaii?
Sure. And we're seeing some of that unfold, and I know we'll continue to talk about that in our time together today. But the Patient Protection Affordable Care Act, many know as ACA or Obamacare, which began in 2010, phases out through 2017. And as a result of that new federal law, there are models of how businesses deliver services that are changing. And there's integration between the healthcare industry and other industries. So you're seeing a need for leaders who perhaps haven't been in healthcare to come in and provide services in healthcare as an adjunct or business partner. Similarly, you're seeing business leaders needing to adapt to new payment models, new kinds of relationships, new roles and responsibilities. And as you all acutely know at the college, everything goes back to the business and understanding really how to make those executive level decisions. And so with the impetus of the Affordable Care Act, it is another stage in the history of healthcare where we need to invest in our leaders, in helping them to be positioned well to understand how to make those decisions, some of which need to be made in very short periods of time with mergers and acquisitions and those kinds of things. And so we see this as a partnership in helping to foster growth and understanding in our current leaders here locally, but also, as you know, organizations need to plan for succession, and we need to start investing now in helping our future leaders to be ready to take those responsibilities on.
Yeah, that's really true, and I think that's why I appreciate the meeting with you and with some of the executives from the ACHE, because these are high-level executives, and I think they have the foresight to come up with a program or plan like that to develop this new program. And I think the succession planning has been mentioned quite a few times, especially some of the conversations that I've had with people in the community. Now, given your role as a liaison between the Hawaii Pacific chapter of ACHE and the national board, so what are some of the things that perhaps you've heard about, given the Affordable Care Act and about healthcare management programs similar to what we're developing right now?
Sure. Well, at the national level, as I mentioned in the strategic initiatives, which folks can take a look at the strategic plan for ACHE, it's on their website at ache.org. One of the values in the strategic plan is promoting lifelong learning, as I mentioned. The other is enabling diversity in the workforce. So I'm going to talk first about just the lifelong learning component of it. That ACHE mines for the content of what is changing in the industry, and annually they provide an opportunity for us to get together for Congress. And out of the most recent one in March, there were topics being covered about population health and payment reform and financial models and things that executives then can understand the competencies that they need to hone their education in on. And so what we're able to do through the relationship with the national organization is get a 30,000-foot view of healthcare, and they provide us with tools at the chapter level to be able to have ongoing education for our members here locally. So I would say that, you know, in the role as Regent, it's being attuned to what those changing themes are, providing some input to the chapter when they're planning their educational events, and certainly in the role that we're collaborating with the College of Business, being able to provide feedback to you all on those industry changes as well.
Now, bringing it back to the program that we are going to launch, again, that's a hybrid program. Given that our state is probably in a unique situation, how do you think the program would benefit some of the professionals who are currently in the healthcare field and those who are interested in pursuing a career in healthcare?
Sure. Well, I'll start first with how it will benefit. We have, as a constituent base, as you and I have discussed about potential students, we have our private sector and public sector employees. We also have a large presence of military personnel here on island. And as you mentioned, the chapter is inclusive of Hawaii and Guam. So if we think about how at times we don't feel as resourced, certainly our members in Guam have even less access to ongoing education. So I think just the distance learning structure of it will enable the ease of pursuing the lifelong learning and advancing in competencies more accessible to them. I think the other thing is just rebaselining the professional's understanding of what those cutting edge topics and themes are. And I know that you all have 5 different tracks of priority in the program, but I think it's the acknowledgement also that executives are very busy, and so the online nature of it will make it easier for them to access. And then we have our neighbor island members, and it's important that we provide value to them. And I think the fact that it is an executive program that's distance learning will also meet their needs. The military personnel, they were affected strongly by sequestration, and that cut back on the funds that they were able to use to travel to continue with their credits. And for those that do get board certified, we're required to have a certain number of continuing education units per year to maintain certification. And so it's just bringing this program into access for professionals will enable them to continue to move along that career path and meeting some of their career goals and objectives, which one is getting a graduate degree.
Yeah, I'm glad you brought that up about the flexibility. And actually, I was at Tripler Medical Center for an information session to talk about this program, and that was actually one question that was being asked because of I guess the assignments, and the service member was asking, well, if I go away, how can I take this program? And even for somebody who I think is stationed at Schofield Barracks, he said, I can't be traveling every day to come to take this program.
Right, especially not now with the construction on the highway.
That's right. Okay, well, let's take a break for now, and then I guess when we come back, we can talk about some of the trends on the mainland schools about a program that's focused on healthcare management MBA programs. I'm talking to my guest, our first guest here, Coral Andrews. She is the Regent of the American College of Healthcare Executives, Hawaii Pacific Chapter. We'll be right back.
Hello, I'm Martin Despang, and I'm the host together with the one and only Ali Yamashita, and our show is called Urban Transcendence. And Urban Transcendence is about identifying where we have a unique situation of a vibrant city in one of the most beautiful natural environments. So how these two can coincide, sometimes conflict, how they could find reciprocity in the 21st century is what we're excited about. And we're planning on bringing in a diverse body of guests, both from the arts and the science and the established and the wise and the emerging generation. So hope you will join us. We'll always be on Thursdays from 1 to 2 p.m. Thank you.
Welcome back. This is Alice Lee Hagan, host to Business Education Spotlight, webcast of ThinkTech Hawaii. My guest here is Coral Andrews. She is the Regent of the American College of Healthcare Executives, Hawaii Pacific Chapter, and we're talking about the Healthcare Management Executive MBA program at Shidler College of Business. The program will be starting in August this year. Okay, Coral, earlier on you were talking about the flexibility of this program, and going back to the trend that the Affordable Care Act, and I guess in researching this program, I've noticed that a lot of the mainland schools, especially the business schools, the statistics for some of the top schools show that for a lot of the executive MBA programs, they're getting an increasing number of clinicians, physicians, nurses, radiologists, all going back to take their business programs. And even in our own executive MBA program here at the College of Business, for this current cohort, there are 39 students, and out of them, there are 11 of them who are healthcare professionals. Why do you think that's the case?
Sure. Well, as I mentioned early in our discussion together, the models of care and the business models are evolving. So some of the terms that the listeners may hear are accountable care organizations, or they may hear about physician integration. So when the federal government sets up incentives in laws and regulations, they say we're going to pay for quality of care. And in paying for the quality of care, you're going to get an incentive so that your payment is adjusted dependent upon what the outcome is. That is all being incorporated into these new models of care, and as a result of that, when you think of the competencies behind that, you have clinicians who are at the service level, clinicians in the leadership level that are informing between administration and practice how to set up the business models. So just the very nature that the clinicians are having a more robust dialogue and input into the executive administration of the organizations, being able to talk the same language is really important. Being able to understand the imperatives and priorities and how you can align your goals and objectives. Those are all, again, competencies that they need to incorporate into their knowledge base. With physician integration, what's happening is you have physicians that are being employed by organizations, and the organization is critical that they be able to partner with their clinical staff. So with physician integration as a model, that is just taking them right up to the executive leadership role. So I would say that those two things are some examples of why you may be seeing clinicians showing an interest into those executive roles. And some, we're beginning to see physician-owned organizations, physician-run, nurse-run. I don't want to leave any clinical specialty out of it, but that's part of what I think is driving that change.
I see. Now, we've been talking about physicians or even nurse executives, but interestingly enough, when I was talking about this program with people who want to find out more information, there are actually inquiries from people coming from a totally different industry.
Right.
I've had a gentleman who called me from the hospitality industry, and he was asking me if he would need any prerequisites to come to this program. So for people who are not in the healthcare industry, what would you recommend? Do you think that would be a good program for them to join?
Sure, I do, and I think that, the conversations that we had back in Chicago in March, we being the group of healthcare, the members of ACHE who met for Congress, there's a recognition of the value that professionals from other industries coming into healthcare will bring. When you think about customer relationship management, the hospitality industry jumps out to me. Who knows best how to perform in an environment where you're competing against another organization for whether your customer returns or doesn't return. So I think the financial track of learning, running a business is common, whether you're talking about healthcare or another industry, is just understanding what the revenue streams are that drive the viability of an organization. I think engineers are another group. We need systems thinkers. With the technology being an advancing attribute to healthcare, we're seeing folks coming in who have technology and computer science backgrounds or information systems. So they come with the subject matter expertise, but the application of that product to this environment will be where their learning will come. But definitely there will be value in having executives coming into healthcare. And I think that there is a consideration about that anyway, as professionals maybe have been in areas where the industry has started to taper because of some of the economy, and they're looking at growth sectors that they can join as a way of ensuring jobs for the future, and healthcare and technology are growth sectors.
Yeah, actually when I was again reading about this program, some people actually compared the healthcare industry as another bubble, another economic growth. So that's good to know, because when I was wondering too whether we should be limiting this program to only people with healthcare background. But I'm glad that you mentioned that there's cross-pollination, because again, based on our other executive MBA programs, our philosophy too is to allow, or we would like to attract people from diverse background with different management experience, so that they can bring different perspective to the program and learn from each other. Now, let's see, maybe I can go back to talk about the structure of the program. This is a 22-month program. We are looking at 2 years of investment by people who are interested in taking the program. This is a business program, so we cover a lot of the core courses in the MBA curriculum. Can you talk a little bit about the healthcare elective side of the program, please?
So I know the ones we've talked about, I don't have them all in front of me, but we talked about population health, I think, so I'll start there. Thank you. So to speak to it from a healthcare side and the value of having that as part of the program, population health just simply means that there's a prioritization within healthcare and looking at how you can promote health by focusing on populations that, let's say, a diabetic population, or in Hawaii, we have cardiovascular disease or obesity. And so population health can be programmatic in nature, but helping business individuals to develop the business acumen around how you apply those skill sets to developing population health programs. So population health is a core priority within the ACA in the new models of care, because if you think about a cost curve, you're looking at being able to bend that cost curve down by managing versus reacting to health problems. So that's very relevant, and patient-centered care, we're certainly hearing about that here at the state level and the governor's initiative around transforming health. The financial decision-making, it all goes back to the bottom line. And I know we have a lot of small business owners here in Hawaii, so you talked about the diverse nature of the student population. I think the distance learning enables the small business owners to be able to participate in a program more readily, and just understanding finances. I mean, whether you're sitting in a boardroom and you're talking about the latest budget of an organization, or whether or not you're planning for new growth to be relevant in the market, those are all critical skills for them to have. The healthcare leadership and human resources management, I'll just briefly reflect back on your comment around diversity. The ACHE, one thing I think we'll be able to do in collaboration with the school is there is an incredible need for expanding diversity in healthcare leadership positions, whether you're talking about ethnicity, gender, age, and so I think by promoting the leadership competencies dependent upon what stage of career folks are, what we're also doing is contributing to a diverse workforce, which is trending in alignment with where the industry is going. So I'll pause there, and we can continue that conversation.
Well, when we come back, we continue to talk about the elective portion of this new Healthcare Management Executive MBA program. My name is Alice Lee, host to the Business Education Spotlight, and my guest here is Coral Andrews. We'll be right back.
I'm Jay Fidel. That's Sharon Moriwaki of the Hawaii Energy Policy Forum. And every Wednesday we have Hawaii, the State of Clean Energy. We've been doing it for some time now, and we have some fantastic guests on there, unbelievable guests who give us insight into what is going on in a very complex, sometimes very confusing, sometimes very disappointing area of progress in the state. So we love doing this. We love meeting them. We love talking to them. We love having their ideas out on the table. So maybe, just maybe, we can all make some sense of what's going on. Sharon, what do you think?
I think that's absolutely correct. We enjoy ourselves meeting with all these people and hearing about the energy and the state of clean energy, and hopefully we advance clean energy for the state. So it's terrific. Join us.
Okay, it's every Wednesday. Okay, Wednesday is Energy Day. Every Wednesday, 4 to 5 p.m. Hawaii, the State of Clean Energy, here on ThinkTech Hawaii. We'll see you there.
Welcome back. This is Alice Lee, host to the Business Education Spotlight. Again, my guest here is Coral Andrews. She is the Regent of the Hawaii Pacific Chapter of the American College of Healthcare Executives. We're talking about the new Healthcare Management Executive MBA program. Carl, we were before the break. We were talking about the elective portion of the healthcare program. So you gave your comments about some of the electives, including the management of population health, financial decision making, healthcare leadership, and health policy. What other electives would be offered?
Well, so I want to just talk a little bit about the importance of the health policy and the legal environment. Some publications, for example, Modern Healthcare is a publication that it constantly gives updates on what is breaking news in healthcare. So when I think about the legal environment and mergers and acquisitions, just yesterday, there are two very large health systems that are collaborating in being able to work together with a common board structure, but not step into the antitrust restrictions that the two organizations coming together may run a risk of violating. And so navigating the legal construct, but at the same time trying to take advantage of the Affordable Care Act's opportunities is something that business leaders really need to understand. They need to be able to look at situations and sort of move through whether there's a regulatory consideration or a legal consideration. And so I think it's having tools in a toolkit of an executive is the way I look at it. And because the environment is changing so rapidly, legal considerations are critical for business leaders at this time. For health policy, I think once you get to an executive level, understanding how to advance ideas, advance initiatives, working within a policy framework. All leaders need to understand policy, but health policy in particular is an important skill set. And I think the last one that you all had on there was health information technology. I don't think there's a piece of literature that we can pick up nowadays where we're not seeing some, whether healthcare or other industries, right, the advancement in the use of technology. And so for executives to be able to be strategic, which is at the executive level, right, strategy and innovation are critical. You're looking at how do you balance out advancing your business priorities in a more efficient way and doing it so that it is supportive of a consumer. All of those are considerations, and I think by exposing executive leaders to that, it's going to help them to have relevant knowledge and expertise to bring to their organizations.
Now, when you were talking about the legal environment, you mentioned that there were two organizations that were merging, healthcare organizations. Are they?
Two hospital systems on the mainland.
Oh, okay,
yeah.
Okay. Now, the way we talk about healthcare right now, it's so business driven, and I read in the Pacific Business News, I guess a few days ago, about St. Francis closing its 24-bed hospice. Now, and at the same time, they are continuing with their $20 million expansion in the Kalihi facility. So if somebody with a healthcare background if this person with healthcare background has gone into this MBA program, how do you think that person would look at this this situation in San Francisco? Can you comment on that?
Sure. I think, first of all, the decisions that healthcare leaders will be will have to make are not easy decisions. So the industry is evolving, and there's contemplation about how do you position your business to serve a mission. So in the example that you gave, St. Francis has a core mission in the same way that we see Queens has a core mission. So everything fits within that framework. So for leaders to be able to start from that framework of mission, but at the same time have insight into what the future opportunities are. So to position a business to be relevant in the future is critical, and to then figure out how you can finance what the future business structure is going to be. So I think, you know, the example that you gave, like that and others we've read about here locally. I think just during the legislative session, you know, there was discussion about the public hospital system. So you could apply this consideration to many different of our beloved hospital and healthcare systems and providers here in our state. And so I think as an executive MBA student, again, I go back to sort of the tools in the toolkit. Which tool are you going to pull out at the time? And sometimes they're all operating at the same time. They have to be able to think strategically. They have to be able to go from an operational competency to an executive level competency. One is more tactical, the other is really thinking more strategically. And so I think what I found not only in pursuing an MBA, but also from what I'm hearing also in conversations with our colleagues, is they have found in a boardroom, for example, that the business background is provides great value in the decision making and in discussions within organizations. So I think that it's continuing to foster awareness and to be able to have employees that contribute value to a business's strategy and priorities.
So I guess we're developing the program in the right direction, since I guess for the first year of the program, students coming in would be taking the core courses, right? And then they move on to take some of these healthcare electives that you just talked about. Right. Now then there is the Capstone Project of the program. So students will go to a hospital and do a project, but they will integrate all the things that they've learned from the program. Any comments about that? Have you heard about any capstone projects in hospitals, and yeah, why would a facility invite students to do capstone projects?
Sure. Well, that's a really great question, and what I want to do is for the listeners, help them really to expand, you know, again, this evolution of healthcare means that care is being delivered outside of hospitals. It's being delivered in hospitals. There are healthcare roles that are direct care roles, and there are roles that are adjunctive to the direct care environment. So many different ways where healthcare as an area of within your career can be applied. So if we have folks that are thinking about the executive MBA coming in from a different industry, you may still be able to apply those skills to another industry. So I want to just broaden their thinking that it may be in a hospital, but it may be elsewhere. The Capstone Project, as I've had a couple of students that have worked on their capstone projects, and I think for those that are willing to be a mentor to a student in their capstone phase of study is very rewarding, because one, it causes you to have to think about things in providing that mentorship and advisement, but the opportunity for an organization to have access to a student coming in that does have, you know, the most current knowledge that they're getting exposed to can also be beneficial to the organization. It could be a future employee. And I think what this collaborative is that that ACHE and the Shidler College of Business are working together on, it also opens up an opportunity for us to tap a higher education network, which ACHE has that relationship with 220 other schools. So you know, we're able to mine from colleges that have had 30-year histories of these programs. So I think any organization that would be willing to work with a capstone student is going to have value add not only from the student, but also from the latest and greatest information about healthcare administration.
That's great. Thank you, Coral. Well, let's take a break. When we come back, we will continue our conversation with Coral Andrews about the Healthcare Management Executive MBA program. We'll be right back.
I'm Hong Jiang, host for Asia in Review on Tuesdays.
And I'm David Day, host for Asian Review on Thursdays. Both of us broadcast our respective shows at 4 p.m.
And my topics tend to deal with questions related to environment, culture, history, and sometimes human rights.
And my shows tend to be on international business, foreign policy, geopolitics, and national security. And you can watch our shows live on the ThinkTech website at thinktechhawaii.com.
And you can also watch us on YouTube or Olalo.
So come join us on Thursdays at 4 p.m. I'm David Day.
And on Tuesdays at 4 p.m., I'm Hong Jiang.
Aloha.
Aloha.
Welcome back. My name is Alice Lee Hagan, host to the Business Education Spotlight, part of the ThinkTech Hawaii webcast series. My guest is Coral Andrews, the Regent to the Hawaii Pacific chapter of the American College of Healthcare Executives. We're talking about the new Healthcare Management Executive MBA program. And before the break, we were talking about the Capstone projects and how it may be beneficial for both the facilities and the students. That brings me to the, I guess this is true also not only for this program, but I guess this is, Capstone Project is something we've utilized for a lot of our other MBA programs.
Right.
And we always get great feedback from the organization and the students. Now, maybe moving on to a slightly different area. We talked about capstone projects with local organizations. Now, how can we make this program relevant to the local healthcare community?
Sure. Well, I think just as we've had some discussions, you know, getting a sense of what the student population may look like, what the cohort may look like, and you know, there's an opportunity for there to be very senior executives, as you mentioned. You may have physicians or nurses or physical therapists that have been in practice for some time, but are deciding they want to go back for their MBA. And so I think it's relevant for those that currently serve in senior executive roles but want to complement their skill set by going back and getting a business degree, a physician, for example, and the physician leadership and integration. So I think the relevance just in that one example is you have the industry evolving, you have models that they're forming, and within those models they have roles and responsibilities that they're going to need to fill with skill sets. And yet there may be a affiliation to their own employees. So we're able to strengthen, and this is one of ACHE's core values, is how do you diversify, how do you create lifelong learning, but at the same time, how do all of those initiatives lead toward ultimately providing better quality of care? So, I mean, you could really jump from the executive MBA program can ultimately lead to higher quality of care because you're enabling the business leaders to have an understanding about how to shape the models for success, and ultimately that means success for those that use those services. I think the other thing is that I think about examples of our neighbor island public hospital system, and you know, being able to help create a way for them to matriculate up through leadership roles. Maybe organizations are not resourced to be able to provide those ongoing just even ongoing continuing ed, although I know that they do have those in the public hospital systems. But this shows an investment by our community in our leaders who provide care to our community. And you know, we're investing in them, we're investing in the prosperity of the organizations that care for, you know, all of those in our community. So I would say that it's just a way of being able to strengthen, to partner, and reinvest in the leaders who provide healthcare services to our community.
That's great. I like this discussion about investment because we certainly have been getting great support from the community for this inaugural program, the dean has decided to put together an advisory board, and I know you are one of the first few members, and it's been phenomenal to have your help and some other executives of different facilities in the community. Tell us a little bit about what you think an advisory board is like, and some of the expectations.
Sure. Well, ACHE as an organization, as I mentioned, has a higher education network, and so Shidler, as part of establishing the relationship with ACHE, submitted documents to verify the accreditation and all of those things. So it's sort of a stamp of approval or acknowledgement, so that as students are looking for which programs to pursue their graduate degrees in, it gives them a benchmark to consider. Because of that relationship, we're able to, as an organization, bring value through this advisory group to the college by tapping our network across ACHE and making those connections for the school. Some of those we've experienced. We've been able to connect with University of Colorado, for example, but not to go through a long list, but there's such a wonderful willingness for professors from other schools to collaborate, from program directors to collaborate. And so I think for Hawaii, just in us as organizations coming together, industry with the College of Business, we're able to have synergistic value, and the advisory group is able to bring in that sort of through a funnel of our network, best practices and learnings from other schools. At the same time, you all are expert in running the executive MBA programs, and so I just think it's a wonderful collaboration. And certainly, you know, we leverage our network to try to get the word out and help people know, hey, we have this opportunity right here locally, which is also wonderful, and preferential.
And it certainly has been a great collaboration. You talked about the network because at the beginning you introduced me to other faculty from some other mainland programs. And just even within the ACHE chapter, you all have opened so many doors for us. I've been able to talk to so many different experts here on island. And of course, with another ACHE member, we again were able to talk to some other really high-ranking programs that are in existence on the mainland. Now, we are actually having our first advisory board meeting next Thursday. Maybe we can talk about some of the different people on the advisory board. I know that we have quite a few ACHE members, but who are some of the other members from the community that you think should be coming forward to join the board?
Well, I would say that those for the listeners, if you think about the tracks, the special tracks. So to restate those, there's population health and patient-centered care is one. The financial decision making, healthcare leadership, and human resources. So I would say human resources might be an area where someone could complement the advisory board. We have the legal environment, and so providing some input from someone that has those experiences, I would say, would be someone. And then health information technology, which could be anywhere from someone with an innovative lean of information technology to really just sort of setting up, you know, someone maybe who has a business that has as a foundation IT, but would want to complement their experience with the development of a healthcare MBA program. So it's really, I think the advisory board's role is to be able to provide that insight and guidance to the curriculum so that it is relevant for the students once they graduate and they can apply it, and And that's tough right now because things are changing so rapidly. But those are a few that come to my mind. And I do want to make sure that as we spend the time together that I acknowledge the leadership of the chapter. Darlena Chadwick is the chapter president, doing a phenomenal job. And I just think that, you know, this is something that is important to leaders in our community, and so we're very grateful that the Dean and you all have committed to establishing this program.
Well, we're grateful too to the opportunity, and as I said earlier on, when I go out to the community to talk about this program, there are a lot of positive comments, and I'm trying to, I guess we're trying to diversify the board members, so we have executives from the healthcare facilities, we have insurers. So it's a great program, and we're looking forward to working with the advisory board. Now, looking ahead, how do you think this program will impact the changing landscape of the healthcare sector here in Hawaii?
Well, I'm going to go back to talking about diversity a little bit. So we know that the industry is changing, and kind of jokingly say within healthcare it's always changing, but it's really changing now. And in order to strengthen it, one of the initiatives that ACHE is looking at is this diversity initiative. So we've had conversations about how do you acknowledge the need for diverse leadership, not only to meet the new requirements and demands, but also to position Hawaii so that it has leaders that can step into these roles as, you know, 5 years forward, 10 years forward, or as you mentioned in the example, you know, you've got evolution of long-time industries here, St. Francis, Queens, things have changed, HPH. So diversity is critical, and when we talk about the advisory board and sort of the relevance in our community, I want to just briefly say diversity means bringing up you know, women and men into those roles, different ethnicities, younger leaders, more mature leaders. So those are areas where I think the advisory group and also the program will help to shape the future of healthcare in the state.
Wow. Do you see that there is a difference? You talk about diversity here in Hawaii. Is this also an issue that some of your mainland counterparts experience or trying to promote as well?
Yes, this is a strategic initiative that ACHE has set as an organization that they are advocating for diversity. And then there's a diversity initiative that as a regent and then as a chapter, we're needing to examine ourselves. So Hawaii, what we've experienced is a little different than the mainland, right? Because we are already ethnically diverse. So when you look at the data in terms of the ethnic distribution of healthcare leadership in other states, you might find a higher concentration of Caucasian leaders, and I'm just sort of stating this is what the data is showing. Or you may have a proportional share of Caucasian male leaders and not as many female leaders. So ACHE has an Institute for Diversity, and they are making it very comfortable for a conversation about how do we as an industry proceed in acknowledging the need for diverse leadership. How do we create learning environments that acknowledge the differences in learning, dependent upon whether someone's been exposed to healthcare or maybe the Latino population, for example. Socioeconomically, how do you create opportunities for them to even have the resources to access the programs? So we will be moving forward as a chapter in examining what does diversity mean for us here in Hawaii within the healthcare executive level discussions. I think for us it's less about ethnic diversity and more about just a recognition organizationally, how do you intentionally prioritize diversity so that you are creating a variable structure to your leadership team within an organization, whether you have, and I think it informs an organization more broadly when you have a very diverse team, but it's more just shaping a culture so there's an awareness about it.
Well, we certainly have this advantage here of being a culturally diverse population.
Right.
You were talking about ACHE's mission, and I'm like your thoughts about, now once we have this program in place and we have a group of students, what can some of the students, are there things that perhaps they can input from ACHE? How do you think ACHE could help with some of the students in this program?
Sure. Well, for one, we have student members in our organization. So I think just as students contemplate what they may want to do with their healthcare executive degree when they finish, the professional association provides an opportunity for them to dialogue with other entry-level healthcare leaders to very senior healthcare leaders. We have a high level of participation by our CEOs statewide, for which we're very grateful. So I think that's one way of just providing an industry relevance back to the students, as the students have all these thoughts and ideas but eventually have to decide how they want to apply their MBA program. The other is, because of the Higher Education Network, ACHE will be providing ongoing support and being accessible to the university as you evolve your curriculum over time, creating those linkages to other universities that have perhaps had programs in place longer that could learn from what Hawaii's doing, but also things we can borrow from other universities. And I think, one of the things we discussed with you all is that as students graduate with their MBA, if they do see themselves staying in healthcare, pursuing board certification is kind of a natural matriculation to being credentialed in healthcare management. And so the competencies in the program, ACHE's done national research on what are those core competencies that healthcare executives would want to have. And to finesse, and we're able to provide that feedback back to the university so that the curriculum incorporates those competencies and positions the students well for whatever next steps they choose, whether it's board certification or something like that. So.
Wow, that's great. That's really exciting. I'm really looking forward to the end of August, when we can offer this this inaugural program on healthcare management executive MBA program. Thank you so much,
Sure,
Coral.
thank you,
It has
Alice.
been a really interesting conversation.
Yeah, thank you.
My name is Alice Lee Hagan, host to the Business Education Spotlight, part of the ThinkTech Hawaii webcast series. We'll be back next week.